a very warm welcome to each of you to this webinar, linking in live from many different parts of the world. Those of you that will experience this broadcast later, welcome to you as well. Good morning, good day, and good evening, wherever you may be. A special welcome to our esteemed panel of experts today, whom I will shortly introduce. My name is Sham, and I am your moderator for this morning. I'm a community pharmacist practicing in the beautiful city of Durban in South Africa. I'm the deputy chair of the Independent Community Pharmacy Association and a member of the Pharmaceutical Society of South Africa, and also an EXCO member of FIP-CPS. FIP's vision is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, science, and education. We are pleased to be delivering this event, which is episode number 10 of our program of 17 events on self-care under the theme of shaping the future of self-care through pharmacy. As healthcare providers, pharmacists have an important role to play in supporting self-care. This program is composed of 8 episodes that refocuses on accelerating universal health coverage for all by enabling self-care through community pharmacy. Additionally, a further 9 episodes will focus on self-care, supporting community pharmacy teams. Next slide, please. So just some announcements and housekeeping for this today. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website, events.fip.org. You may ask questions using the question box. You're welcome to provide feedback at webinars@fip.org. And also, we encourage you to become a member of FIP, and you can find that in the FIP.org website under membership registration. Next slide, please. So none of this could happen without support. And our partners for this event is Ricket, and FIP would like to thank Ricket for supporting this program via an educational grant. Thank you, Ricket. Next slide, please. Today, we will continue to focus on accelerating self-care to achieve universal health coverage with the main aim of identifying mechanisms that will enable and strengthen this process. Our program today, after the welcome, entails 3 presentations that are listed in this slide. Post that, we would have a panel discussion, and hopefully your questions that will come through will be answered by the panel, and we will close off at 12:30 Central Time. Next slide, please. So the learning objectives for this morning will be to discuss approaches to rebuilding healthcare during the pandemic, list factors that enable self-care through community pharmacy, describe trends in self-care, and explain how to integrate self-care as a building block to universal health coverage. Next slide, please. Our first speaker for this session is Jurate, and I would like to welcome Jurate. Jurate is the Director General and is responsible for providing strategic direction and leadership while managing the day-to-day operations of the Association of European Self-Care Industry. She represents the self-care industry in various international, European and national forums. Welcome, Jurate, and the floor is yours.
Thank you very much for introduction, distinguished chair. and it's really good to be here with you today. I'm sure that for many of you, especially those connecting from Europe, are more than familiar with me. I have been working for a pharmacy profession for at least a decade, and my move to self-care industry, I hope, comes not as a surprise, because I would just like to reiterate that in the self-care and self-care industry views pharmacists as a very important people that guide citizens in their responsible self-care journey, and also provide a risk mitigation so that the products, the self-care products that are dispensed in the pharmacies, are not abused and are used in the appropriate manner to deliver the health outcomes. So next slide, please. So what I would like to start with is just sharing a little bit about my organization. So ASGP is the industry association, which a sponsoring company, actually Reckitt, is a member of. And here we are united under one mission, which is to advance responsible self-care. And as I said, the role of the pharmacist here is extremely important for us, enabling citizens to take better care of their health needs, and at the same time contribute to the sustainability of European healthcare systems. And this is the overarching topic of this webinar, which I'm happy to contribute. I also would like to say here that as manufacturers, we have a responsibility to provide medicines and other self-care products that are of high standard of safety, quality, and efficacy that meet legal requirements of packaging and labeling, so that we ensure that citizens can practice responsible self-care, including use of self-care products, and are encouraged to seek advice with appropriate healthcare professional that in many cases will be a pharmacist. You can go to the next slide, please. Many of us take sort of self-care or non-prescription medicines, food supplements, and self-care medical devices that we have under our umbrella for granted. However, I want to share some numbers which I hope will show you the importance of the self-care that we often that goes unnoticed. So 1 out of 2 packs of medicines are non-prescription, at least in the European region. This accounts to more than 9 billion non-prescription packs being dispensed mostly through the pharmacies. We also see more or less 1 billion packs of minerals and vitamins that are purchased every year. At ASGP, we maintain this database, which is accessible to everyone on our website, where we list active pharmaceutical ingredients that enjoy non-prescription status. In this database, we have more than 200 active ingredients, and this accounts to more or less 4,000 self-care products, because as a pharmacist, you know better than anyone that competition in self-care industry is very, let's say, very good. We have a lot of alternative products, either within same active pharmaceutical ingredient or with very similar therapeutic option that you can choose from as a citizen. In Europe, we enjoy a recognition also of the self-care since recent revision of the pharmaceutical legislation, which allows to switch products from prescription to non-prescription via central route, which means that a company can apply for centralized switch and gain an access to the EU 27 markets in one go. Since 2009, we had seen 6 non-prescription medicine classifications going this route. You may think it's little, but in fact for us it's quite a lot, because this route is reserved for really innovative switches, so normally first-in-class switches that are going through this way. We also have a new regulation which is recognizing substance-based medical devices, and I think this is where, whenever I can, and I talk to a pharmacist, I think this is where we can do a little bit of a better job to understand the medical devices regulation, which is not necessarily always taught in the pharmacy curriculum around the world. You can move to the next slide. So I think with this introduction, I come to the topic of the today, which is how and what role self-care plays in rebuilding of the health systems post-pandemic. So here I must say that the problems which we see in the healthcare are not because of the pandemic. These problems have been there for already a long time. And I think what we see because of the pandemic is more that those problems became more acute, and we have become more aware as a society of those. So I think what we can say is that the health system, any health system today, cannot actually be sustained without the self-care. which means that individuals have to take responsibility for their health outcomes. And like this, to sustain the iceberg, the top of the iceberg, which is called the health system. We all know that our health systems have been built in the post-World War II era, when, let's admit, the society at that time was fairly young. Therefore, this is a system which is a sick care system, which means that you wait for a person to get sick before you start doing something. So I think when we, possibly with the acceleration of pandemic, and I think there was already enough of awareness and thinking of how to rebuild the systems or how to rethink the healthcare systems, it's clear that we need to think of how to prevent people from getting sick, how to actually prevent disease and encourage self-care, so that instead of actually being the passive users of healthcare services, they can proactively take care of their health and possibly prevent some of the disease from happening. So you can go to the next slide. And I think here we felt that we all recognize that self-care is important, but it's very important when we talk to the policymakers and all the stakeholders in promoting the self-care that we bring numbers. So in order to bring those numbers, we have undertaken a study together with a research group from Germany called May and Bauer, where we try to quantify the current input of the self-care into sort of broader economy and the healthcare systems. So we have developed this sort of algorithm or methodology, if you wish, where we try to compare how much does it cost self-care, which very often we recognize is going to be actually a pharmacy care supported by a pharmacist, versus actually someone turning up in the general practice doctor's office, that will often result into a prescription medicine and possibly some other costs will be incurred, not counting on the cost on actually visiting a GP. And of course, we recognize that there is always a thing called doing nothing, and that's perfectly justified in certain cases. But we actually were looking into those cases where we could, or where we currently today have a self-care versus actually turning into the doctor. So if you go to the next slide, we developed this methodology focusing on the European region. And instead of going into country by country, which would be impractical and the study would take really ages to deliver, we tried to group the countries according to some basic parameters, like, for example, the cost of the GP hour time, cost generally of working hour of the person that is visiting GP, etc., etc. So if you go to my next slide, so I just want to sort of zoom in on those parameters that we have put into this sort of algorithm that we have developed. And quickly, I will share you the outcomes and the calculations that we have actually established based on this to prove that self-care is really an important part of the health systems and economy at large. So if we go to the next one, in Europe, we have resulted into kind of a quite heterogeneous map where we have developed 11 country clusters, and there are some clusters like, for example, the cluster 10, which is Sweden alone, which we could not actually compare to other countries. So very often, I think here we assume that countries are very similar and we can just sort of copy paste what's happening and it's working in one country and move it to another. So I think this is one of the learnings of this exercise, is that it's not like this. You need to go actually much more deeper and try to understand what are the health system parameters so that you could be able to compare the findings and group the countries together. So moving to the next slide, please. So we have actually compared these costs of self-care versus the medical care. And as you can see, those range quite a lot from country to country, and they're not exactly comparable. Because if you see in the cluster 2, which just quickly, if you were to look back, I'm sure that you cannot, but in front of my eyes, I see this is, for example, Luxembourg. So in Luxembourg, actually going into your pharmacy for a minor ailment is 41 euro cheaper than actually someone turning up at the GP's office for the same minor ailment. And then if we look down the line, so it's country cluster 5, so this is mainly sort of the eastern countries in Europe, together with Cyprus and Malta. So there the savings of turning into the pharmacy versus doctor's office is going to be almost 12 euros actually. So it's not to say, and I think you quite recognize that 41 euros doesn't equal 12 euros, but also if you look at the sort of GDP of Luxembourg versus the eastern countries, there are still quite big differences. So it's just to say that there is a significant case economically for turning more people into a pharmacy and practicing self-care versus those people actually turning up for those minor ailments like headaches, colds and coughs, indigestions, etc. at the GP's office. You could move to the next slide, please. So actually, I'm not going to go in country by country, as a SGP role is to cover the entire European region. I want to share some of the sort of highlight numbers of what the self-care savings are today to the health systems and broader European economies. So we have calculated that on average in Europe, we have 1.2 minor ailments that we self-manage ourselves, very often by turning up into a pharmacy. Our estimation is based on the sort of calculation that there are around 6.6 billion minor ailments in total, and some of them we will do nothing, while 1.2 we will actually self-manage ourselves. This results in cost savings for the health systems of 23 billion euros, mainly due to the time saved of the physicians, time saved of the patient, treatment costs because non-prescription medicines that are reimbursed are not being prescribed, etc., etc. And further 10 million are saved to the national economy because we avoid the absence from work. I guess pharmacies are very popular mainly because you can access them much longer than the general practice doctors' offices. And this is also a great saving that you can achieve by actually allowing people time, which they can spend doing better things than sitting in the waiting room of the general practice doctor. If you go to next slide, I think this is a number which is, at least for me, the most impactful one, is that if no self-care products, basically if no non-prescription medicines in Europe existed, we would need 120,000 extra GPs, or the current GPs that we have would have to spend 2.4 hours longer every day working to cover those cases that currently are being dealt with by people themselves or in the pharmacy setting. If you move to the next slide, so from personal perspective, people are saving approximately 106 minutes by doing self-care, so turning up in a pharmacy or just digging into their home cabinet instead of seeing a general practice doctor. 22 minutes we calculated of this time will be working time, and this actually accounts to 9.30 euros of the savings. And for national economies, this is 4.84 euros per sort of minor ailment which is treated by self-care. You can go to the next slide, please. So the question today as well is how we can rebuild, and for us, the question is how we can do more self-care in order to release those health system resources that during the pandemic we all became very aware that are very, very scarce. So there are two directions into the sort of the self-care diagram. So you can go breadth or depth. What do we mean by that? Is that, first of all, please go back to the previous slide if you can. So what do we mean by that is that we could actually encourage more people that possibly do nothing today to do self-care, and those that are turning up in the GP offices also could be there. And the other option that we could do is actually to have more applications for non-prescription medicines, so more switches, more molecules that could be available as an OTC. If you go to the next slide, please, this is where we compare the countries in the depth of the self-care. So you see that if we compare Poland to Netherlands, in the Poland, 32% of minor ailments today are treated with non-prescription medicines, while in the Netherlands, it's only 7%. And very often this means that a big percentage of these people are actually ending up in the GP's office while they could actually be equally well cared for in the pharmacy setting. So the potential here in terms of the deaths is really, really huge. You could turn to the next slide, please. So what we have done in the sort of the methodology of ours after we estimated what we save today is looking at the potential. And of course, the potential will again, European potential is one thing, but actually it's important to look in country by country. So this complicated graph can be explained quite quickly. So on the horizontal axis, you have the number of non-prescription medicine INNs available as an OTC in the country, while on the Y-axis, you have the deaths, so the uptake of the self-care in the country. So you can also realize that in those countries where you don't have a lot of INNs that are available as an OTC, and where uptake of the self-care is also not very good, there is a greater potential than in the countries where, for example, in the United Kingdom, you already have a lot of molecules that are switched to OTC, and the uptake of the self-care is also quite enormous. So there, the potential, but we still believe more self-care could be done even in the United Kingdom. So basically, you see that depending on which country you are in, the self-care has a different sort of potential. And we estimated it and calculated what it would mean if we advance the self-care in Europe altogether, of course, recognizing that in some countries the potential is greater than in the others. So if you move to the next slide, we have developed a sort of a conservative scenario. And according to this scenario, we could increase the self-care uptake in Europe. So this is the aggregate, of course, recognizing that in some countries you would have to increase more than in the others. We could increase it by 48%, and this would result in 17.6 billion extra euro savings to the health system as well as to the national economies. So actually moving from the scenario which we have today, which we are saving 36.72, if we were to do more, we could save actually additional 17.60, and we could arrive to 54 more or less billion euros that we could be saving by actually making sure that people are enabled and supported to self-care more. If you go to the next slide, this is again the translation into sort of health system perspective. This would mean that we can free up 58,000 GPs in Europe, or every GP that we have today could save 1 hour a day, either to possibly enjoy free time or take care of very complex cases, which actually should be turning up into the GP's office. If you go to the next slide, so I mean, natural question that we would have is how can we achieve more self-care? So there are two sort of streams of what we could do. So first of all, it's very important to recognize that national framework is extremely important. So socioeconomic setting of the country, healthcare system, whether it recognizes and supports and enables healthcare, whether we also have a whether self-care is supported by general practice, doctors, etc., and also switch climate for the non-prescription medicines from the RX status. Because sometimes we have a very conservative regulators that do not believe that certain products that may be OTC in majority of the member states in Europe could be safe in the country X. And this is really disappointing because that is a direct sort of also sign that the pharmacy profession is not exactly very trusted by the regulators, which is really disappointing for us as well. Also, not only national framework has to be fit, there has to be incentives for those actors that are engaged in the self-care. So those are three groups of actors that we believe are very important. So incentives for consumers, incentives for general practice doctors, and incentives for the pharmacists. What comes to incentives for consumers, there are a lot of things that could be done, from establishing sort of a call lines where you can dial in and ask for advice before you actually decide to book an appointment with the GP. There are also in some countries, for example, in Belgium where I live, we have a self-care budget, if you wish, which is provided by our insurance agency. So you have a health insurance, and a certain amount of money you can spend on the OTC, and then you can claim it back from the insurance. And Belgium is not alone, and you have many other countries that provide this sort of incentive for people to self-care. Incentives for general practice doctors, we have, for example, green prescriptions in Germany, where they can prescribe OTCs actually that are not reimbursed. And incentives for the pharmacists also range from actually minor ailment schemes where you are paid for the certain consultations, to also support to the pharmacists for the education and different other tools that are enabling you to counsel and support self-care. If we move to the next, I just want to share some of the best practices in what comes to political measures, which for us are very, very important to set the right support framework for more self-care. So those countries would be Ireland, which has a list of the medicines which they would like to see OTC, and they encourage the companies to actually switch them. In Finland, we have a strategy which is encouraging medicine users, so the consumers, to assume responsibility in their therapy, and they encourage actually sort of the more OTC use via pharmacies. In Switzerland, we also have a framework which is touching on the pharmacy profession, where diagnosis and treatment for minor ailments are already recognized as a function of the pharmacist. And also a lot of things, as I said, United Kingdom is in front, not for no reason. They have sort of a lot of guidance and different support tools to make sure that people think pharmacy first and self-care first before turning up into the doctor's office. So in my last slide, I just want to conclude that while we talk a lot about sort of pandemic changing things, I think my message here is that governments faced unprecedented constraints to the healthcare expenditure and system capacity way before actually the pandemic, because of the aging population in Europe, or because of actually increasing population in some of the developing countries. So this is not new, but I think with the pandemic, we really were faced with the fact that we had to stay home and take care of ourselves so that we could save the health system resources for those that were sick with the COVID through the number of the lockdowns that we have suffered in the recent year. I think encouraging self-care and having individuals take responsibility for some of the interventions, either to treat minor ailments, to control symptoms, prevent ill health, is an obvious response. And I hope that with our economic study results, that you will ask me where they are. They are not released yet. We are aiming for a scientific publication, so therefore we are not publishing them before we actually achieve that. So we hope that this is going to be our contribution to this public debate on how to actually rebuild better. We do believe that pharmacists are at the forefront of these changes, and two roles for them: so guiding individuals in making healthy lifestyle choices, recommend appropriate self-medication, and signposting citizens to physicians when you detect it's needed. And more than that, I think, as I said, in some countries, the issue which we have is very conservative regulators that believe that people cannot actually take care of themselves, is trying to convince them that pharmacists and their guidance can actually be the sufficient mitigation measure to make sure that medicines are going to be taken responsibly. And just the last point is that self-care is the starting point of healthcare, is not a no care. And I think this is also the mentality that we have to change together. And it should be part of integral national health policies and incentivized by government. And those incentives, as I said, those incentives have to be targeted to those stakeholders that are important in encouraging self-care. And I pause here. Thank you very much for your attention.
Thank you, Jurate. That was an amazing presentation and very informative in terms of the economic value. And I think the European model of providing data around the value is certainly something that we will be looking at expanding in other countries. So my next speaker is Ruben Viegas, who is currently the Practice Development Project Coordinator of FIP. He was one of the authors of the Community Pharmacy Global Report 2021, and a pharmacist that hails out of Portugal. He is currently enrolled for his PhD program focusing on promotion of physical activity through pharmacists. So the floor is yours, Ruben. Welcome.
Thank you very much, Sham, for the nice introduction. And thank you, Jurate, also for amazing presentation that sets the scene perfectly and makes it easy for me to speak. Also, thank you to Chris and FIP for the invitation, although I'm part of the FIP staff. So I want to bring you a bit of the perspective on how to enable self-care from the community pharmacy contribution. And as you said, I have some experience in community pharmacy in Portugal and in Spain, which are very similar countries. But still, I want to bring some topics and then some examples from this experience as well. So in the next slide, we'll see that we have self-care as part of universal health coverage. And Jurate already mentioned all of this. So reallocation of healthcare resources so we can save more time and more GP time for the more serious complications, while in the pharmacy we can have more time for the minor ailments and for simple treatments. And the healthcare cost savings was also really well. I saw the numbers of Luxembourg of 41 euros difference. I thought it was quite important that these savings are relevant and they are measured, and there's data on this. So it's important also to consider that self-care can bring healthcare cost savings. And then we have improved emergency preparedness, and we saw this also with the pandemic. I was working in the pharmacy, and we had a lot of people that couldn't access the GP's offices, so they came to the pharmacies to seek advice or to buy paracetamol or to buy any kind of products that they might need during the lockdowns, for example. And in the next slide, we can see a definition of self-care. And I bring you this because the other day I was talking with my mother, and she was saying like, no, self-care is only the things that you do for yourself, right? I was like, no, mom, self-care is a range of activities. So if you look at the WHO working definition, it's the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability, with or without the support of a healthcare provider. So here we see that the with support of the healthcare provider is also in self-care. If you want to learn more about this, you can see online the self-care Continuum, which basically sets a range from pure personal responsibility to pure medical responsibility. And you see in the middle, there are many things from daily choices to minor ailments or even major trauma. So you can see that self-care is really a broad range of things, and it's not only the self part of taking care of yourself. And moving on, we can see what is the contribution of the community pharmacy. One of them is helping people making healthier lifestyles. So if there's some problem with indigestion, we can advise some kind of proton pump inhibitor, but we can also say that that person would need to take more care of the food they have or avoid certain products. Then we have to ensure that people make responsible use of prescription and non-prescription medicines. So both of them, the pharmacist can contribute, especially if people are if they're polymedicated and they have a lot of medicines they're taking. Then we have self-recognition of symptoms, self-monitoring, and self-management. And this is important. For example, if we look at the allergy season, and if the person comes to the pharmacy for years now, the conversation would be the person already recognizes the symptoms and probably comes to get some antihistaminic pills or a nose spray. So this confidence, so this relationship of trust also helps the people to be empowered when they have this symptom to come and get further help or just get some medicine to treat their symptoms. And the last, and one of the big and important ones, is also support in increasing health literacy and patient education. So if people are more literate about health and they're more empowered, they will probably make better health decisions with the support also of the pharmacist, of course. And if we move to the next slide, we'll see that to do this, pharmacists, to do this kind of support to people, pharmacists need some support as well. So this can be done at the national level with the pharmaceutical societies through the continuous professional development schemes, through the industry as well, that they can provide scientific information to pharmacists. But international level, FIP is also providing resources to pharmacies. So on this area of self-care, there is a joint policy statement between FIP and the Global Self-Care Federation from 2019 about the responsible and effective self-care. We have a publication, Pharmacy as a Gateway to Care, from 2015 that represents and talks about also this role of self-care and how pharmacies can support the populations. This quarter, we also released 2 more publications that I'm working together with Gonçalo Zapin, which is the FIP lead for practice and transformation. One is about the cold, flu, and sinusitis. So the symptoms, the similarities, the differences, and how pharmacists can support people with these conditions. Also a small note, comparison with COVID-19 symptoms together in this toolkit. Then we have a separate self-care toolkit that will also talk about 6 different disease areas, and that is also an important resource for pharmacists that want to get to know more about self-care. Self-care, it's also, as I said before, a very broad range of conditions, and pharmacists need to invest also time to get to know all of these symptoms. It comes with also with experience in the community pharmacy. Then we have an online program that we're on. So it's Shaping the Future of Self-Care Through Pharmacy, that also covers different topics. And the 2020-2021 FIP report on community pharmacy that I will talk on the next slide. You'll see that in last year and this year, FIP released a survey on community pharmacy, self-care, and digital and online pharmacy operations. And this was done also because to advance self-care in the countries, we need to have a clear understanding of the panoramas, of the systems and the regulations in the country. So we asked countries what the situation in their country was. So this survey was conducted between early November 2020 and January. It counted with 137 organizations from 118 countries. And we had responses from 89 organizations from 79 countries. So quite a good response rate, 67%. And also we have around 50% of the world population covered by these organizations, which is also quite a positive number to understand at least part of the panorama on self-care. So in the next slide, I'll present three drivers for self-care. And the first one, and then I will present the infographic from the survey that you have available, and you can see and you can find in the FIP library in the FIP website. So the first driver that I wanted to talk about a little bit is workforce. So we can think that countries that have more pharmacies and more pharmacists will have more opportunities to offer self-care support. So we can imagine that if countries with extensive rural areas or areas without a lot of healthcare system points of contact, the pharmacy can be very important for that people not have to drive 1 hour to access a healthcare service. So this idea of the workforce, and also the workforce needs to be trained and needs to have, the countries need to have the capacity and the quality. So pharmacists should be trained not only for self-care, for other roles as well, but it's important that the workforce is capable of delivering healthcare services. And we can see in the next slide the infographic for this information that we take from the report. So you have the numbers, 3.5 million pharmacists and 1.8 million working in community pharmacy. And you can see in the map the different shades of green. So the darker the green, the more pharmacists per 10,000 population there are in the countries. And you can see in many countries, for example, in Africa, the lighter green means that they're still, and in Asia as well, in the Southeast Asia region, we can see that there's still maybe a lack of workforce in those countries. And if you look in the bar chart below, you also have the different numbers per country. and a sample mean of 2.75 pharmacists per 10,000 population, which is already quite positive despite the global differences. The second, in the next slide, we'll have the second driver that I wanted to bring. It was also, there are more drivers, but these three were also what I believe they were the most interesting to put here and discuss for this event. The second one is access to services, because pharmacists can provide a range of services depending also on the country and the regulations and the pharmacy itself. I worked in a pharmacy that didn't have a private consultation room, for example, so it was harder to provide services. But that if we have a pharmacy that provides more services for disease prevention, management, and care, then we can provide also better care and can provide better results to people. And as I said before, self-care is also, if we provide a service, then if we follow up with that person, we're also empowering them and going together in the journey of taking better care. So, and here also the part of about trust, because when you work in the community pharmacy, normally people trust you. So it's important that you take this trust and use it for people to make better health decisions. And we see in the next slide the infographic about the services. And you can see that in yellow, for example, there's more the clinical decision-making skills. And we have many situations, for example, on the emergency contraceptives that we need to provide good advice on how to maintain good sexual health and safe sex, for example. Then on the bottom, you see the first aid kit, which is also an important part of the community pharmacy. Some people that fall on the street come to the pharmacy. We provide first aid, for example, or provide materials for this first aid. Then in more orange, we have the services in the community. So not only in the pharmacy, but sometimes pharmacists go and do home deliveries or go to residential care units and provide also this care outside the pharmacy. And we also see on the top left part the testing, which is also, as I said before, quite important, as when we provide a test, we already have that person interested in understanding the result for their condition, and therefore we can do a follow-up and we can provide also this self-care advice together with them. And lastly, the third driver is regulation, and Jurate already mentioned a little bit. So regulation of non-prescription medicines is important, so we can ensure that medicines are safe, and if they are safe, then we can have different layers of access for people to use them. So we don't need all the time to go to the GP, because we already saw the costs and the burden that this can have in the healthcare system. Nevertheless, it's important for the pharmacists to be present also in some cases where there could be safety issues, to reassure and to pass the messages. And if we look at the infographic on the next slide, we'll see that we asked countries if they have in lighter blue exclusively and non-prescription medicines exclusively dispensed in community pharmacies and not elsewhere. In the darker blue, we have the non-prescription medicines not disclosed in the pharmacy, but there's a pharmacy only list, which means that those that are on a pharmacy only list can only be in the pharmacy. And then we had in yellow the non-prescription medicines not in the pharmacy, but there's also not a pharmacy only list. So here we can see that there are differences. Even in Europe, if you look, there are a lot of colors, and in the same in Africa is also very different according to the countries. But the important part is also this regulation needs to be adjusted to the socio-economic status and also to the pharmacies. So if the pharmacists can support this decision, people will have the correct access to medicines, even if there is not a pharmacy only list. So to summarize, we'll see in the next slide that pharmacists can enable better care and can every day provide advice and guide people to make better choices. And if you're working in the community setting, I'm pretty sure you already did it. And I also invite you to write in the chat some ideas or some situations that you had where you supported self-care in the pharmacy. If we have services, this is also important to empower patients to take better care. And besides the trust component, also the private consultations, so the privacy for some topics that might require more privacy. Then we have the trust as a key link to the pharmacy. I think this is pharmacies normally rank among the most trusted professions. So it's important that this trust is there and we take good use of it to empower people. And the last, the correct regulation of non-prescription medicines can reinforce also this pharmacist role in promoting the responsible use of medicines. And I think that is it. I'll look forward to any questions you might have. Back to you, Sham. Thank you.
Thanks so much for that, Ruben. And thanks for that interesting presentation. We're really looking forward to your PhD findings on the pharmacist's value in this healthcare space. There are a few questions for you, but we'll come back to that later. It's given me great pleasure now to invite Dr. Padmaja Kamath, whom I've had the privilege of working with recently. She is Director, Regulatory and Scientific Affairs at the Global Self-Care Federation. Padma works closely with members and relevant stakeholders to ensure evidence-based self-care products and solutions are recognized as key contributors to healthcare for both individuals and systems worldwide. Welcome, Padma. The floor is yours.
Thank you, Sham. Thank you very much for the nice intro. Good morning, good afternoon, good evening, everyone. I would like to first of all thank FIP for hosting this webinar, and it's a pleasure for me to speak here on behalf of the Global Self-Care Federation. So let's get started with the next slide. Very quickly, just to introduce you who we are. We at the Global Self-Care Federation, we represent associations and manufacturers from the self-care industry and are committed to promoting sustainable growth and better global health outcomes for all. And we want to see self-care embedded in health systems. We are also a go-to source for self-care information, and we work closely with as Sham mentioned, members and relevant stakeholder groups to help them deliver better choice, care, and value. We are an NGO in official relations with the WHO since 1977. The next slide, please. So by now, we all are aware of what self-care is, what it entails, and the benefits of self-care for individuals and for the healthcare system. So let's quickly jump and see what's the future of self-care. In general, as I mentioned, our aim is that self-care is embedded into the traditional health systems, providing better choice, value, and improved health outcomes for all. But looking in terms of the future for concretely, we foresee that due to rapid evolution of technology and an estimated shortage of about 12.9 million healthcare workers by 2035, we see tech and digital healthcare to flourish, with pharmacists to be as the core healthcare professionals facilitating self-care. In terms of individual empowerment, telemedicine, self-care literacy will be the key aspects supporting it. Moreover, in terms of self-care as a universal health coverage, it's a corner block for it. It's important to showcase the economic and social value to leaders, regulators, and policymakers. Global knowledge transfer for better global health is also important. Experiences are shared through health systems so that the repetition of mistakes are avoided and there's no need to reinvent the wheel. The next slide, please. I also take the opportunity to introduce you to one of our new tools, the Self-Care Readiness Index, where the details of this presentation come from. The SCRI is the first of its kind research and policy tool that explores main enablers for the readiness across healthcare systems in different parts of the world. With overall aim of this self-care readiness index is to support the universal health coverage. The specific one include providing actions for designing of better healthcare systems targeted towards decision makers and healthcare professionals. I invite you to take a look at the summary and the final report of this self-care readiness index. The next slide, please. In terms of the methods that were employed, so the index has four crucial enablers. So if I have to name them, it's the stakeholder support and adoption, consumer and patient empowerment, and self-care health policy and regulatory environment. As you see, these are the strongest pillars that enable or influence uptake of science-based self-care practices and products. Then there are also 3-4 indicators in support of these enablers that demonstrate the self-care readiness across the 10 geographies that were studied. And these countries were chosen in consultation with the WHO to include developed and less developed self-care markets. The next slide, please. So in general, there are three main themes. In addition to the four enablers that we mentioned, and these were analyzed across countries. So these themes were first the self-care as both a concept and a term. The second is individual empowerment to boost health literacy, receiving credible and consistent sources of information aligned with healthcare providers. And the third, self care legislation, where we see quite some inconsistencies between government programs. The next slide, please. Now, in terms of the four enablers, like I previously mentioned, you'll have to click again, Chris. Yeah, a couple of times to get there. Yes. So in terms of the four enablers, they're quite broad. And as you can see, they range from individual and social factors to the ones oriented around policy and regulations. So as you see, it's quite broad and quite relevant to harness the power of self-care for health systems. The next slide, please. Now, let's distill all of these themes and enablers down, and then we come across three essential pillars for success and uptake of self care in future. The first one, like I mentioned earlier, are pharmacists, because pharmacists offer the primary care and support in many cases, and increasingly we see that their roles are evolving. The second, like everywhere, digital technologies are key enablers as well in uptake of self-care. And third, effective regulatory framework to support the first two pillars of pharmacists and digital technologies and self-care in general. So let's in the next slides do a deep dive and see what they have to offer. So all actors in the self-care in the healthcare system, including nurses and pharmacists, play an important role in self-care, which is particularly evident after the COVID-19 response that we've seen. So pharmacists are typically the first point of contact for a consumer or a patient, like Ruben already mentioned, and their roles involve reviewing, prescribing, dispensing, administering medications. In several cases, they ensure continuity of treatment, and they are able to modify prescriptions and also offer, other allied services like walkthrough and dispensing medicines and changing the prescriptions and so on. So they play a central role in promoting disease prevention. So if I have to say in a nutshell, they are gatekeepers preventing misuse and abuse and use of counterfeits and substandard medicines. And think of them in the UHC context. When pharmacists chip in, quite a big burden on healthcare systems is relieved. So, a key learning from COVID 19 also indicates this, that when healthcare systems are overloaded, pharmacists come to rescue because they are a trusted source of information and advice. So, to understand this in details, just along the lines Ruben mentioned, I invite you to take a look at the joint FIP and GSCF statement from 2019. The next slide, please. Now, let's see in terms of examples. In many low and middle income countries, we've noted that this is a successful model wherein clinicians, for example, pharmacists and community health workers, are utilized robustly. This type of care model has the potential for reaching far more patients with messaging and education on self care. When I say utilized robustly, it means pharmacists and community health workers are part of multidisciplinary care teams, empowering patients and consumers to engage in self-care activities. Successful examples of this model, for example, include Thailand's village health volunteer programs and South Africa's community healthcare workers who bring knowledge about how to manage diabetes, hypertension, and other NCDs to rural areas. Pharmacists, in particular, have fully realized role as members of the patient care team, shifting the responsibility away from nurses. In Egypt, for example, consumers may obtain drugs in pharmacies, including online, but only after an interaction with a qualified employee, for example, a pharmacist or a pharmacy technician. Another important point to touch upon is educating and incentivizing these multidisciplinary teams comprising doctors, nurses, pharmacists, etc. And members of this care team, when they are equipped with the right tools, are able to catalyze self care behaviors. From the healthcare provider's perspective, if you see coming out of Brazil, Egypt, Nigeria, Poland, South Africa, and Thailand, we know that it's possible to financially compensate the time spent by these pharmacists and community health workers in discussing self-care can be compensated. GSCF recently organized a webinar on evolving role of pharmacists in increasing access to self-care in Africa. I invite you to take a look at the recordings and note the case studies presented there. The next slide, please. Now let's see what digital solutions have to offer. So there is a global trend of increased interest in self-care, which has been triggered by COVID-19. So as per SDG 3, digital health is also vital to ensure good health and well-being. Digital solutions have further helped in self-care, bridging the gap between available services and patients. They're also disruptive. They help in improving outcomes by aiding access, affordability, efficiency, and sustainability while delivering quality. Now, digital transformation has been a key strategic pillar in many continents and is seen as a driving force for innovative, inclusive, and sustainable growth. And since many emerging countries have fewer legacy challenges, adoption of digital solutions is quite a leapfrogging opportunity. Now, in terms of digital solutions, these revolve around how a patient is engaged, how patients' education can be enhanced, enabling communication, and patients in the end increasing access. The next slide, please. So, COVID-19 has taught us many lessons, one of them being that when individuals are provided with correct information, it empowers them and they grab it. During the pandemic, several governments reached out to their populations using digital technologies, and this communication should continue in the post pandemic world. For example, in low and middle income countries, they've enjoyed particular success by deploying relatively low cost digital health solutions to promote self care, pointing to the potential of these interventions. For example, in partnership with the Self Care Association South Africa, SHAPRA is building an online directory of Schedule 0, 1, and 2 registered OTC medicines. So, this is a mobile friendly directory that will make it easy for consumers and healthcare professionals to access drug information. Another example coming out of Thailand is where health communication strategy involves TV briefings by a national spokesperson from which information can further be disseminated via social media. The Ministry of Public Health's e-health strategy also has this unified health data platform with standardized electronic health recording system. So you see from these two examples, you see digital tools can be in different directions, yet help increase the universal health coverage. The next slide, please. Now, we all are used to apps, we are all used to digital technologies to managing our own health. So here, what we think is behaving and seeking care, all of this enhances the efficiency of the healthcare system. The more we can manage ourselves and triage our condition, the more we optimize and reach out to the public healthcare system for help. The next slide, please. In terms of health literacy of patients, education through digital health is a key asset. In the mode It is a mode using which patients and consumers receive correct, reliable, and trusted information on health condition and the product that they are supposed to use. This indeed empowers them for self-care and self-medicating correctly. For example, the Brazilian government during the times of COVID used a WhatsApp channel to distribute health information, and then they partnered to launch this especially customized for COVID-19 problems. So this used to exist before COVID as well, but during COVID, it was further heightened. The ministry is also active on social media, for example, Facebook, Twitter, YouTube, Instagram. In Egypt, the government uses also WhatsApp channel to communicate health information, and it was set up even before the COVID era. So, the Ministry of Health and Population launched the WHO's Health in Message SMS service, which provides advice on living with diabetes and other information related to NCDs. In Nigeria, for example, the Federal Ministry of Health is very active on Twitter. And in 2020, they even set up a WhatsApp channel wherein people could chat with the Nigerian Center for Disease Control and clarify their doubts. In terms of the patient information leaflet, like we've mentioned, going ahead, this area would also be touched upon by digitalization and cover quite a lot of assets. For example, instructional videos, pictograms, etc. There is an ongoing discussion right now amidst several geographies between regulators and market authorization holders on how to customize these patient information leaflet and how digital tools could also work in unison. So the next slide, please. In the end, the overall aim is to increase the access of OTCs, knowledge on how to address minor ailments, which products to use, and ultimately this results in right medication. So e-commerce specifically in this regard helps increase the access. Emerging e-commerce regulation also aim at ensuring supply of quality OTC medications, especially in light of COVID, where it means that there is distance maintained and social contacts are reduced, and also increase in the access for rural areas. Other advantages of e-commerce also include cutting down on some third-party margins, so that makes it a low cost, that makes self-care products low cost, and also privacy and convenience for consumers. There are also, in terms of pharmacovigilance, with the rise in social media, it leads to increased online reports of adverse events and by customers, and customers are able to seek help 24/7 by using sophisticated chatbots. The next slide, please. However, having said that, there are quite a lot of disparities around the world in terms of availability of non-prescription medicines. And this leads to consumer access disparities. Hence, the recommendation of the self-care industry is to recognize the value of e-commerce that it brings in both social and economic terms, to introduce regulatory policies and mechanisms that facilitate access to self-care products while striking the right balance with the level of health literacy in general population. This also brings me to the next point of why supporting regulations are important. The next slide, please. So an effective regulatory framework is a cornerstone enabling all of the other pillars that I mentioned above. Today, most regulations and processes around them are different around the world. Self-care, as we know, when appropriately deployed, has the potential to solve world's most pressing macro public health challenges, including pursuit of UHCs, prevention and management of chronic diseases, and also providing high quality medications for fast growing aging population. While many of the countries that we see within the SCRI seem to recognize the potential of self-care in terms of NCD prevention or management, even if it's not explicitly labeled like that, there are still some opportunities to build institutional capacity to understand and implement the potential of self-care. And in this context, it is really important that there are policies put in place that support the use of products. So one of them could be risk-based and streamlining regulatory framework when deployed for better access to non-prescription medicines, and also leveraging best practices in terms of cooperation, reliance, mutual recognition, harmonization between the national regulatory authorities from countries where OTC frameworks are already in place and are effective, both in terms of regulatory processes and also in terms of scientific knowledge. When it comes to advertising and promotion, it is really important to educate patients and raise their awareness. This is also a tool. However, in many geographies, OTC products face restricted communication to consumers due to uneven regulations and currently in place in many countries. So it is both. Like there are countries wherein it's not allowed and there are countries wherein it's allowed. As we've seen earlier for digital marketing, low and middle income countries really are technologically advanced and are endorsing digital advertising will make it an important tool moving ahead. So if I have to conclude, the next slide, please. A broader alliance of self care advocates is needed to make the case that investments in self care result in happier populations and lower costs. Pharmacists contribute to universal health coverage by increasing effectiveness of care, thereby reducing costs and risks of misuse of self care products. Digital tools are also important enablers in terms of consumers to navigate through their own self care journey. And last but not the least, coherent healthcare policies and regulations touching upon strategies, plans, programs of self care are needed for increased adoption of self care behaviors. Thank you. Back to you, Sham.
Thank you so much for that, Padma. I think the issue of digital health and collaborative practices are certainly a model with key elements that we need to put forward in terms of universal health coverage. So let me then move on straight into the next slide, which is really our panel discussion. And I'm going to invite the panel to put on their cameras and keep their mics open as we go through some of the questions. I know there's been an attempt to answer some of them, but maybe I'll just open up those questions again so that we have the rest of the panel also participating. And the first one that was answered by Jurate, but Jurate, you're welcome to comment on it again. This is from Khabo Khomapi. My colleague in South Africa actually is our chair of the Independent Pharmacy Association. So I understand fully his concerns around the pushback from GP, because we've had that recently, especially with pharmacists' involvement in HIV, for example. So I'm going to open that question up again. And Khabo wants to know, how do we deal with GPs' pushback that pharmacies are gradually infringing on their scope of work and consequently their economic gains through these programs? So let me start with you, Jurate. I know you gave some answers, but maybe just comment on that. Jurate, your mic is off. Can you put your phone on? Yeah, thank you. Still off? I still can't hear you. Okay, no problem. Let's then move on. Padma, would you like to take that challenge and maybe give some comments from your own experience? You can put your mic on.
Yeah.
Thanks.
Yeah, Sham. So indeed, I would really refer all the colleagues who are interested in this topic to kind of view our last webinar from Africa, wherein we did have a doctor presenting his case and explaining to us how pharmacists and doctors can really work in unison with each other, collaborate to ensure that proper advices are given to patients.
Thank you, Ruben. You'd like to take this challenge on again?
Yeah, from my experience, it's I worked in pharmacies where it was very easy to just call the doctor and say that was a problem with the prescription, and it was very easy to solve. And also some workplaces that were this was harder. But I agree with you that there's room for collaboration, and I believe that the important part is also to think of the patient as the end user, and the outcome should be always thinking on the patient. So that
Thank you for that. Thank you for that, Ruben. Jurate, are you back on? No, unfortunately, you're still off. Sorry about that. We'll keep trying there. I wonder if from Ruben, from your point of view, when we put these projects together on self-care, should we not at that strategic level start to include the GP networks to be joint participants, so that when we do come up with the models, maybe they would be co-owners of the strategy and might be easier to sell that to the GP networks and to other healthcare professions. Any comment on that?
Yes, thank you, Sham, for the questions. In FIP, we've been delivering some events together with other healthcare professional organizations, mostly on vaccination. So when we think of that, I think it would be important also to have this same approach also to self-care and to other topics. So include as much as possible the other healthcare professionals, including the GPs. But I also think that then the work needs also to be locally. So there needs to be a good integration of the healthcare systems so pharmacists and doctors can work together in the local level, because it's good to have this awareness at the higher level, but it's also important that the health systems are built in a way that these collaborations are easier to happen.
Thanks for that, Ruben. Jurate, you still
Can you hear me now?
Oh,
Can
perfect.
you hear me now?
Brilliant. Yes. Go on.
I managed. So no, I just wanted to say that I don't know what you have discussed, but it's inherent that when the pharmacies are getting more sort of competent and they're taking over certain competences of the GPs or whoever it be, that the affected party may not feel so supported at the beginning. This is just the nature of change as a process. So I think for me, there are many things that can be done, and I heard that you talked about collaborative practice, where you discuss and you show and reassure of the competence and quality of the pharmacy intervention to the GPs. That's one way forward. And on the greater system perspective, we have seen that in the countries where GPs are paid per capita sort of subscribers to their practice versus per visit, there's always a greater interest to get sort of less people in the practice, or so that they can spend more time with those that are coming in and really do the proper job on the complicated cases. So I think it's often going back to the economics and sort of rethinking how you pay each healthcare provider. For me, is an important part of this conversation of sort of who does what within the primary care in particular.
So Jurate, you're coming up with an interesting concept. Are you suggesting then that maybe the payment system should be based on per capita rather than per service delivery per patient? Is that your suggestion on this?
Not necessarily a suggestion, it's more an observation. And it's, for example, this is coming, I mean, the country which comes to the top of my head is UK. So United Kingdom, a GP is paid for sort of subscribers to their practice, and then they get additional sort of incentives for certain services. They have targets that are imposed by NHS that they need to meet. So I think a mix of pay for performance versus pay sort of a lump sum every month helps them to see the collaborative care in much brighter light, put it that way.
Thank you for that. Ruben, you answered the question from Irana on the MUR services, and I see you commented on the vaccine that was not included. Is there a suggestion that in the future, FIP would be including that in some of our studies?
Thank you very much, Sham. Yeah, so specifically for the vaccination services, we had a previous publication just that year on 2020 that focused on that, also because of the COVID vaccines and everything. But there's quite a broad range of services as well in the community pharmacy that we can encompass. So also not to make the service very lengthy, otherwise we don't get as much feedback as needed. Sometimes also need to prioritize. But if you think of self-care related services, we can really have a huge list of services.
Thank you for that. Irana, I hope that satisfies your answer for that. Let's move on to Khabo's next question, which is around FIP's influence on progressive regulations in emerging economies and trying to advance that in there. I also see, Ruben, when you presented your graphs, your maps of the world, there were some missing data in part of Africa. So there's an assumption either that they have reported and they don't have enough pharmacists there, or is the study showing that there is missing data from that continent? And maybe you can take both of those together. Thanks.
Thanks, Sham. Yes, so the survey only had a limited number of participants. So for the other countries, it's we didn't have a response, so we don't know the situation. Ideally, we would have 100% of the countries represented, so we could see these differences. But unfortunately, we didn't. And I think that's it. There was another question.
Yes, so that was the mapping issue, and Khabo wanted to know, how do we influence progressive health regulations in emerging economies?
Yes, so on that, I believe that in FIP and together, for example, with the Global Self-Care Federation and the SGP as well, we have this more policy work, and we need to bring the voice of the pharmacists and associations on these topics. But then the change needs to happen at national, local level, and there the players are normally the professional societies or the governments or both that need to implement these changes that are happening globally.
Thank you very much for that. We're very privileged to have our previous chair of the community sector, and that's Lars, who's now Vice President of FIP. So welcome, Lars. It's really a privilege to have you here today. And I see Padma was brave enough to take on the challenge of Lars's question around increasing the number of NPMs, so it is more equal in all countries. You want to comment further on that, Padma?
Yeah, so as I already said, and I see Jurate also raising her hand. So as I already said, in my opinion, and I speak with the regulatory affairs hat on in here, the sharing of best practices, the sharing of scheduling lists and so on, that makes a lot of sense because, you know, there are quite a lot of countries who have already put in place the OTCs framework, and the emerging economies can kind of, you know, see what the pros and cons were, because these systems have been in place for quite some time, and kind of, you know, take it up so that there is no reinventing of the wheel required.
Perfect, thank you. Jurate, you had your hand up. You want to go for that one again?
Yeah, thanks, Lars, for the question. And definitely, even in Europe, where you would expect that things are very similar, they are far from that. And you have seen in my sort of this country graph that we are talking about the countries that have 5 INNs versus countries that have 160 INNs available as an OTC. So there are many ways that we can do it, but one of the things that we are suggesting as also regulatory measure is creating some kind of panels where we could be talking as an industry, but as well as, for example, bring on the pharmacy profession with the regulators and warm them up to the idea that we can trust citizens to do the right thing when they buy the OTC products. And just, I mean, in my previous role, I already said that I worked for the profession for quite some long. I have been faced by regulators in Europe that do not trust pharmacy profession. So, for example, I had a conversation about switching triptans. So I don't need to explain to pharmacists what it is. Switching triptans centrally. So that would mean it would have access to the EU 27 markets. And at that time, the regulators, they had the scientific panel where we had some neurologists sitting there, and they were claiming that behind every single headache, there could be aneurysm or a tumor or whatever, and therefore switching triptans increases the risk of actually underdiagnosing and sort of going wrong. So I think this is the problem, that when we talk with the specialists, when we talk to some of the people that are regulators, they cannot wear the shoes of a regular consumer, and also the trust in the pharmacy profession, because very often they know what they do. They don't engage in the conversation in the pharmacy. They also don't have a big confidence. So I think for us, it's a way to go, and that's why we are talking to the pharmacy profession as regular as we can, because I think this is a battle for the industry, but also for our pharmacy profession. So to be trusted to handle the more complicated OTCs, or in some cases, actually, it's quite simple OTCs that are not being switched, and sort of enlarge the scope of pharmacy practice and give more instruments to keep people away from actually turning up at GP's office unnecessary.
Any other comments from anyone else in the panel? Okay, so we've got a few more minutes, so let me throw one more question into the panel, and that's related to the dangers of self-care, especially if you allow decision-making in the hands of the patient without sufficient information. And what we're finding, for example, in many countries, products that were regulated within the framework of pharmacy has been moved out of our regulations and into a higher schedule and therefore not accessible, especially in the pain market. So any comments on how we can put in strategies to try and mitigate that and ensure that we don't lose more products, but really self-care gains more products in the hands of the pharmacy? Let me start with you, Jurate.
Yeah, so this is, we see rescheduling also quite often, and we can say that there are some countries that are more prone to reschedule without actually having a conversation with let's say, manufacturer. So there are a lot of risk mitigation that could be put in place. I mean, the most easy one is updating the product information leaflet. So we spend a lot of money testing the product information leaflet with the consumers, making sure that they understand what the instructions are. And if we see a new concern, we would update, and we would be required to update the leaflet and make sure that the right information is available with the pack. Other things that we do is, for example, raising awareness of the pharmacy profession, which is handling OTCs, of the specific changes. So therefore, we have, unfortunately, it's still called in Europe Dear Doctor letter, but this Dear Doctor letter is sort of Dear Healthcare Professional letter, which we also have to send to the dispensing professionals and to the prescribing professionals informing of these changes. Education, we also engage with the pharmacists to make sure that, for example, in dispensing software, you update and you can have a pop-up box to remind that there is potentially an let's say, interaction or safety concern. So I think we see pharmacists as an integral part of the risk mitigation for our products very much. However, I must say we cannot protect everyone, and there are plenty of people that do wrong thing, be it a detergent, be it a medicine. And I think we need to develop a system for those that are behaving, say, somewhat rationally. And we cannot build a system based on those that are going to do not the right thing just by nature. So I think this is where we very much hope that the profession will work with us to make sure that more OTCs are available and that they are part of our risk mitigation plans, so that it's in the hands of the pharmacist to have that conversation if this OTC is the most appropriate for the consumer in front of them.
Thank you, Jurate. Padma, you want to take that and some final conclusions from you?
Yes, indeed. And this is also something that we've been discussing excessively amongst ourselves and amongst with the regulators as well, especially in the context of the e-leaflets that Jurate mentioned. So that is like an important tool to empower patients to really, use the medications correctly. So right now in the paper form, it's accessible to everyone. Everyone who goes and buys these medications is able to use it, read it, and use the medications in a proper sense. But then when we go on to the e-leaflet perspective, that is like one leap forward, wherein we have much more tools to inform the patient of how to use the medication that he or she is intending to take in a proper manner. So these could be like pictograms, these could be with videos, and then to update these as well in an event of misuse or abuse, it's quite a lot easier, because the person we just have to go through the website of the market authorization holder or the regulator and flip the video or make it more informative and little bit, adapt the information that's given in there.
Thank you very much. Ruben, I wonder if I can get you to take the last question that's on the chat box there, if you can see that, from Enoch. If you can just take that, he's talking about leveraging the role of the pharmacist as in terms of the central benefit and technology, and what is FIP's perspective on this?
So as I see, it's also a bit about healthcare collaboration and patient care. So it's as I said before, and in FIP we're very open to have discussions. There's the World Healthcare Association that we're working together. So also bringing together nurses and doctors and other healthcare professions to bring and debate different topics. We'll have also on the 21st an event that also brings the civil society perspectives. So it's also the role of a situation like FIP is also bringing a table so people can sit and discuss these kind of topics. So I hope I answered the question.
Thank you so much. One last question there. I wonder if one of the panelists would like to take that before we close. We've got about 6 minutes. It says here, how can we see the future of value-added medicines in the future globally? Anyone wants to advance on that one? From Lakshmi? Or Lakshmi will try and get an answer for you and put that on the chat box or for future reference. So if there's no other questions, I am going to then conclude. If you can just put up my last 2 slides there. Thank you. So just in terms of conclusion, just one back, please. Thank you. Advancing self-care will contribute to the sustainability of healthcare systems, and we have been presented with convincing models. Jurate did that, showing the social and economic value of self-care. There are several factors influencing the uptake of self-care, but to make it happen requires the combined effort of government, recipients of care, and the pharmacy team. Ruben showcased some of the important work done in FIP around self-care, touching importantly on the different services that pharmacies can provide beyond dispensing. I encourage you to access and share those ideas in your country via those FIP documents. We also identified as important the workforce, access to services, and regulations as key healthcare drivers. Padma critically identified the key enablers and pillars for self-care success, with a focus on digital technology and an effective regulatory framework. Increased access, cost, and quality of care are key, and all of this must be done and built into the framework of patient safety. All 3 speakers agreed on one point, that the central role of the pharmacists and their teams in ensuring a successful outcome to self-care implementation for universal health coverage is absolute key. Next slide. So the next session that's supporting self-care is a discussion on disinfection in common conditions, and this will take place on the 15th at the same time. Please access the website. Next slide. Access all the events, digital events of FIP at events.fip.org. Next slide. So again, a special thank you to Ricket for supporting this online program through their grant. I would like to sincerely thank our brilliant panelists and the very competent FIP staff that assisted in this efficiently coordinating this event. And lastly, thank you for spending the time with us today, and I wish you a pleasant and successful week ahead. Thank you, everyone. Take care.